MDNews Network's David McDonald recently attended the Medical Group Management Association's annual conference in New Orleans, where he caught up to medical practice manager Susan Dymond from Holy Cross Hospital in Taos, New Mexico. Here's that special report.
All right, we're back again with Susan Dymond from Holy Cross Hospital in Taos, New Mexico. Susan is a medical practice manager for the hospital, managing several medical practices. Is that right?
That's correct.
How many practices are you managing?
I manage 4.
And what types of practices are you?
I have an OB-GYN practice, Women's Health Institute. I have a surgical practice that includes general surgery and a urologist, a rural health clinic in Penasco, New Mexico, and manage the employed physicians within the hospital, such as the hospitalists and a number of mid-levels.
Right, so you guys are obviously EMR.
We are going to EMR next week.
Is that a fact?
Yes, sir.
And how's that? Tell us about that journey for you.
It's been very interesting. The hospital actually started out probably about 2 years ago looking for an EMR, not specifically for the hospital, but more so for the entire medical community within the Taos area.
Right.
We're sort of remote, sort of small, but we have a very strong physician health organization, or hospital physician organization, a PHO. And I think a little unique in that a lot of collaboration and cooperation. So actually next week, not only are the hospital practices going live on Athena Health, but 2 of our big primary care practices in town
Is that a fact?
are going all at once.
So you've collaborated with non-physician-owned hospitals and
absolutely.
Non-hospital-owned physicians. And
absolutely.
That's great. And so coming here to New Orleans and seeing all the technology, this is an amazing conference because there's so much technology present. How did you receive what you saw here based on the fact that you've already invested in and are about to pull the trigger on implementing EHR at this level? Was it a surprise, or were you pleasantly, or was it a disappointment, or were you happy with what you saw?
Well, I've been coming to MGMA meetings for more years than I want to admit. And have learned a lot over the years. I actually came this time to see what do we need to do next. What do we need to do in terms of accountable care organizations, in terms of patient-centered medical homes, and how can we use the decision we've made this year to move into EMR and then springboard from that into where we need to be to serve our rural community. And meet the challenges that are there.
So what'd you find? I mean, here you are, you're invested, you're about to pull the trigger, you walk in here, and this place is chock full of what's next. And so what is next?
Well, what's next for us is you know, we anticipate it's going to take a good 6 months to a year to get fully
up and running with
running and really comfortable with what we have. The PHO has made a commitment to explore an accountable care organization for the community.
Right.
So our challenge now is to make sure we create the appropriate RIOs, that we have the appropriate interconnections, not only with what we've determined to be what will work for us, but you know, acknowledging that there are a couple of other practices in the community that are not on the same system, and how can we integrate the hospital information and the practice information, and going, because we are remote, you know, to Santa Fe and Albuquerque, where we do refer a lot of patients to. So what I've been looking for here is how do I make that interoperability possible with the decisions that we've made and move forward from there.
Yeah, that's a good that's sort of a good trend, I guess, because you're going to see that hospitals are going to have to sort of reach out into the community and connect with those folks who are not necessarily a part of that.
And I've worked in a lot of different communities. Taos is pretty unique in the level of collaboration and willingness to do so.
Yeah. So are you happy with what the technology people are doing? Do you feel like they're thinking along the same lines as you, or do you feel like some people may be out there?
Well, some of it's a little segmented, but I think over the years what I've seen and what I've seen this year is there is much more focus on interoperability and much fewer silos and more coming together, and I think that's what we're going to have to do.
Great stuff. Well, thank you very much, Susan, and have a great rest of the conference.
Thank you.